what is the problem when you get narrowing there? What can that do to the brain?
Yeah, so in some circumstances, a little piece of plaque can break off of that area of narrowing, or what happens is that there is a relative area of low pressure just beyond the area of narrowing. If you imagine kind of a dam in the water, just beyond the dam, you might see these swirls, and same sort of thing happens with blood, but the problem with blood, unlike water, when blood doesn't move or moves very slowly, it forms clots. And so just beyond these areas of narrowing, a little clot can form, and when that breaks loose, that can cause the stroke.
Big trouble.
Big trouble.
What are some of the symptoms if somebody gets a stroke?
So on the side that's affected, they'll get something called amaurosis, which is blindness of that eye, where it's like a black shade coming down over the eye.
Because the carotid artery eventually supplies the blood to the eye.
Exactly, yeah. The first blood vessel that comes off of that internal carotid artery goes directly to the eye. And so temporary blindness in that eye is a sign that that carotid artery is causing trouble. The other thing that can be caused is on the other side of the body, the arm or the leg or both can become weak or numb. And the reason for that is the way that we're all born. Our wires are crossed in the back of our neck in the brainstem. And so the right side of our brain controls the left side of our body and the same vice versa. And so if that half of the brain gets angry because there's a blood clot or a plaque that's gone up in there, that affects the function of the other side of our body.
So those are warning signs. When you have those symptoms, what are you supposed to do?
Immediately go to the emergency room.
And 911, get the emergency room, maybe take an aspirin, maybe not, but they can tell if it's an explosion stroke or a narrowing stroke.